Couple of friends here to talk about that. And this is a fireside chat. So we miss the fire, but we are getting cozy with our mugs. Thank you, Carmen, for that. Let's show it.
As a startup entrepreneur, you always have to be promoting. So
yeah. So a fireside chat has to be cozy, has to be kind of informal, and has to touch upon the things that are more or less concerning all of us. And yeah, the Draghi Report, everybody talks about that, but who has actually read it? Raise hands. Just
Nope.
3, 4? Okay, good. It's okay. No, I mean, there's a lot to talk about that. There's a lot of pages to read. ChatGPT is very useful to get the most of it, and this is what we did, so probably we will talk about that. The first thing is that let's recognize that we are in a very nice place, so thank you, Miquel, for helping us also enjoy again a session here. This is a place where in the 18th century some commercial transactions took place, and those were about competitiveness as well as the Draghi Report, so we thought that would make a perfect place to talk about it. The second thing is that a lot of things are happening now. So I took my 2 friends here and I said, why don't we talk about that? And she made a lot of research on that, so she's going to be also very instructive. And we've read, for example, that, I mean, if you look at a Lancet paper that was published not long ago, last year actually, it said healthcare is not mentioned, and just as a pharma reference somewhere. And then you see Erordis, which is an alliance of rare diseases that say, thank you, Draghi, for mentioning healthcare so much, and also for touching upon the needs of the patient. So where are we actually? So this is going to influence the EU Compass, the next Omnibus, the next Biotech Act. Everything that will come in the next 5 years is going to be following this. So Cecilia, I will ask Cecilia to introduce herself. You love her. And then talk a little bit about what you learned from your research on the Draghi Report.
Thank you, Montse. So my name is Cecilia Edebo. I'm from Sweden. Don't speak Spanish, sorry for that. I'm the CEO of Sahlgrenska Science Park. We represent a portfolio of startups in the healthcare industry. Before joining 10 months ago, I was actually heading as CEO of a unicorn startup in the healthcare industry, which is today, proud to say, a leading company in its field. I also have a background of starting up 2 more companies in the field, and actually one is an MNC today. So I think I have a good track record in terms of talking about startups and innovation in healthcare. But I am humble to the patient side of things and healthcare as such, because I'm the business one. But I think the key thing here, and as you said, Montse, I've done quite some research on the Draghi Report. I'm sad to hear that you haven't, because it's going to dictate a bit of our future. It's a scary report. It's scary because it identifies that we're lacking competitiveness in many of the key technologies. Key technologies such as energy, clean tech. But as you rightly said, Montse, it only mentions pharma. It doesn't mention healthcare. It mentions...
It does.
It does.
But how?
It mentions patients. It mentions health data. But I think there's more to health and healthcare. So it mentions pharma, but it also mentions why we're not competitive. And I think that's 2 key areas which we will address. Declining R&D investments over the years, and an increasing regulatory framework that is today so complex that, just as a very sad example, it takes a drug 450 days to get an approval in the EU, whereas in both China and the US, it takes 330 days. So we're just 36% worse than everyone else. And I can rate all the other continents are better. So that's a sad point. But what more worries me most is back to the healthcare part. Because it mentions pharma, and yes, there are a few mentions, but pharma is not healthcare only, right? It's only a part of healthcare. So healthcare as an industry is missing. We're completely missing out that healthcare is an industry, and you're a great example of it. It's an industry, and there's a great opportunity to actually grab that. If we don't have health, do we need clean tech and energy? No. We need healthcare as an industry, and we need to start looking at it as an industry. With that said, yeah.
I give you the point, but actually when you look at the chapters in document B, because document A is about the diagnose, and then the B starts saying, okay, you need to do that in this industry, in energy, in, I don't know, materials, and then it says in pharma. That's exactly this. And then it talks also about IT, AI, and then healthcare is like the application for that, but not really as, the start and the end of the thing.
No.
So I think that probably, I don't know, Carmen, you have to introduce yourself. People know you, you're a local champion.
So I'm fangirling.
You're a local champion,
but being here with both Montse and Cecilia, cheers.
Cheers.
It's humbling to be in the presence of you two, so thanks.
Oh, come on.
We were preparing for this session, and I haven't read the full report, to be honest. Like, we went through we used technology
you're a sandbox.
for good.
Then you're
exactly.
a sandbox.
And take the advice of Google before. Do a chat GPT or a chat Google on it.
Or Gemini.
Or Gemini, exactly.
Run it. No, so it forgets, only focuses on pharma and tiptoes around it. And then it doesn't even talk about patients. And as Cecilia well pointed out, if we don't take care of our most precious asset, which is health, nothing else, makes sense. And then the other thing that worries me from a geopolitical standpoint, and again on the timings of regulatory affairs and so on, is we're putting all of the different verticals under the same regulatory affair process. So, we as a young company have had to, we are registered as a medicine and have to follow all of the processes. I don't think the impact that using Doctomatic has is the same as taking, an antibiotic. So why are we all, and then we're Europe's becoming the big regulator, but not the executor. And there's a huge amount of companies in the healthcare industry, mostly biotech, that are having to go first into the US because regulatory affairs here are taking forever.
But yeah, I will ask you, I don't know if you read, Draghi is the guy now. If you read, there's an article he wrote 1 week ago, and he talked about a regulatory pause. So what would a regulatory pause mean for you, for example, as a company in the sector? What do you expect of such a thing happening in Europe?
What do I expect?
A regulatory pause, they stop regulation for a while to help us catch up with the other regions in the world.
I don't get what you're saying.
Yeah, so for example, they say all the regulatory subjects that affect now our industry, the issues that are affecting the regulatory pathway, they intend to stop it a little bit, to pause the regulations and help the companies go ahead. Do you believe that could happen? How you see that from the industry?
No.
Not happening. Who would be the first to do something like that? National level, regional level, European level?
But the ones to lose is the patient, right?
Absolutely.
Because we have such a regulatory complex framework today that if pausing it is a nightmare. So the only thing to do is to actually release it and move towards something that is much more progressive. Today, we're not attractive as Europe to innovate in because it's too complex, and we're a too small market, so you go to the US instead. And that's sad, but healthcare is an industry, and it concerns the whole world. So if we were good, if EU was good at healthcare, we would rule the world. And I think what Draghi mentions in the report, two very strong things. So it's not all sad and bad. It's two very good, strong things. We have a wealth of data. We have a wealth of data. And we have fantastic ecosystems and a culture of collaboration.
But what would Carmen
data's-
say about the real-world data,
data's-
for example?
Data's worth nothing unless you're going to do something about it.
Use it.
Like, so
Okay.
and I think Rock Fages earlier was saying the same, right? Like, and even Nuria from TIC Salud Social, you know, like,
Yeah.
you can have data, you can have a wealth of data, but it doesn't mean anything unless you do
So what
something
would you
about
expect from the next 5 years at that level for you to help you ahead?
Well, all of our data points are actually key proposition for sales. Like you know, how many CO2 emissions are you saving by allowing data to travel rather than having clinicians and patients traveling? Being able to understand the patterns of, say, a 45-year-old female that is under a lot of stress, you know, what the pattern is when you've got sufficient data. So if we did something about it, I don't think we're doing it. I don't think we will be doing it because of the regulatory barriers.
Yeah, so Draghi mentions, and go back to the report, in document A, I counted 12 times, and in document B, 100 and something, 110, something like that. So it is mentioned a lot, health and healthcare. So it is mentioned in terms of resilience, it is mentioned in terms of education, it is mentioned also in terms of a place where AI can be really the driver for transformation. So how do you see your ecosystem in Sweden and your ecosystem here in Catalonia ready for that? Sweden, you start.
I think we're more than ready for it because it's required from us. If we want to make sure that patients in the world and health prevails, we are ready to move. And with the wealth of data that we actually do have, and we in Europe, across in Sweden as well, in Nordics, we are especially good at data, but we're super bad at using it. So we have a movement right now where we really believe that, you know, using the data, the wealth of data, using the fantastic collaboration culture we have across Europe, that can put us in the driver's seat of healthcare industry globally. We can create preventive measures like Doctomatic, we can create precision medicine, and we can rule the world. We just need to see healthcare as an industry and use the assets that we have and stop regulating ourselves. Because today, US is the innovator, China is the copying machine, but they're becoming the innovator, and we're the regulator, and that's not going to work. So this is not a clean tech or energy problem. This is a healthcare problem, and your and my health and the patient's health should come first. Because without health, we don't need energy.
Okay, can you react to that, Carmen?
Can I react to that? I think, are we ready? Yes. Are we doing something about it? No. It still takes forever to make innovation and adoption happen. I think it's a top-down approach whereby we're not allocating budget for innovation. So I would love to see, okay, you're getting a 10% of our, annual budget is for innovation, and the savings that you generate from that will be added on to the following year's budget. And being able to do more sandbox and everything. They're expecting young companies like us that are, mostly bootstrapped or mostly all of the healthcare companies I know are underfunded from scratch.
And which could be a model that you would like from other places to be implemented here? Something that you have read, for example, I know that the US is a totally different market, but for a company like yours?
I'd like to see, because 95% of our healthcare public, I think when you're looking at who the payer is, then you have to have the payer involved. But that also means educating the work labor force, understanding that we're here to support them, we're not the enemy. We're here as an enabler so that they can actually dedicate quality time and face-to-face time with their patients. So am I going to go to the next appointment just for a simple cough? Or am I just going to do a video consultation and get my e-prescription so that my doctor has additional time for someone that is suffering cancer or a rare disease or is an elderly patient that actually needs the support of having a conversation for the sake of their mental health?
Exactly. So we touched upon the readiness of the ecosystem to implement some of these, pathways to speed up a little bit the industry. We talked about how this is really an industry, and it is sometimes lacking this whole vision. It's sometimes seen as a place where technologies happen, instead of being seen as a place that drives technology to happen, which is different. And also we are talking about the needs of specific aspects like education, like funding, like regulatory, like policy prioritization on these subjects. But I would like to ask you also about the main health challenges that we have. They're not in the report. So if you, for example, were asked to write some pages of a chapter on health for the Commission, saying, okay, hey, you missed that part, what would you say? This is an industry, but further, how can we from our industry help solve these global problems, and how really Europe is relying on the competitiveness that we can provide from our system?
Preventative care.
Again?
Preventative care.
Preventative care. So I want to hear more about that.
So again, going back to the patient, and what Cecilia said, if you're not taking care of your biggest asset, then there's no industry to be had. So
and we are not there yet?
I don't think so, at all.
And with data? What would you do with the data?
Yeah, but I think back to the fact that what you just said is that we look at the healthcare as a cost of society. We don't look at it as an industry and an investment that we can actually generate revenue from. That needs to change. It shouldn't be a cost and a burden. It should be an industry that you could flourish, and we would all benefit from it. It would be increased patient care. You would have preventive medicines. You would have precision medicines. It would be much more efficient than it is today. And you would have the whole healthcare system being much more effective. So it's the only sustainable solution for the future of healthcare, because we need a transformation. We have chronic illness. With the aging comes the chronic illness. We have cancer. There's more cancers today than there were yesterday, and there will be more tomorrow. Infection prevention control just flourishes across the globe. Yep. The more, the merrier, unfortunately. And it's just simply not sustainable. So the whole transformation of healthcare requires a different view on healthcare. And that's why we need to stop looking at pharma. We need to start looking at healthcare as an industry. And again, back to the fact that we're really good. We can do something here. If we just understand that we can use the wealth of data, use all the great innovations that come from the ecosystems, we're there.
I love that word. So let's touch a little bit about the word ecosystem. And I will also ask you, Carmen, about that. But Draghi says that only a few very powerful, strong ecosystems across Europe, in advanced therapies, for example, instead of a fragmented landscape of small places where things happen. Which is your view on which is better for Europe? I have my idea, because probably we cannot intend to go for this Europe of widening, and where every single region and country has the chance to develop their own, a place where ecosystems really are based on the values of the territory that they are, growing in, with the companies and all stakeholders living the same kind of values and visions. But this is kind of incompatible with a single, 2, 3, 4 large ecosystems in Europe and the rest just being behind. So
I'm a strong believer of community and the power of community. So again, thank you to Tech Barcelona for doing all they do, because it's an amazing organization. BioCat as well, EIT Health at a European level. So communities are the driver at a local level, but then in terms of making things happen, some of the frameworks are actually barriers. So for instance, we're classified as a medical device. I can operate throughout the European Union, and that's why it's called a union, so we should be able. But for me to operate in Germany, they expect me to deliver an additional clinical trial within their territory. Oh,
you know about that? You mentioned that a lot as well.
Yes, it's horrible.
So that doesn't make sense.
No.
So rather than capitalizing on on these things, we're actually generating more barriers. Spain has 17 autonomous communities. You're having to negotiate with 17 different entities in order to be able to work. So, and be able to operate, and translate that in how many countries are there in Europe. So, and sometimes it's a top-down approach, sometimes it's a down-up.
My only concern is if we...
It's mostly a grassroots effect, work with your community and build it up.
Yeah, but if we stick to this idea of a few ecosystems, at the end of the day, where there will be regions without the capacity to grow this industry that you were referring to.
Yeah.
But then you can, yes, please go.
Yeah, but the
back
strength
to
of an ecosystem is that you build on each other, right? You and I build on each other. We all build on each other. We come together from different industries to actually build the healthcare industry. That's how you build an ecosystem that is efficient. If you start, if it's healthy also with ecosystems because they increase competition, but as long as you build on and piggyback on the next guy's developments, then you're really successful. So back to the fact which you mentioned, Carmen, is if we achieve EU union, we build on each other, but then we should apply best practices across.
Exactly.
Because otherwise we don't do the best for the patients.
So
if it's a proven clinical solution, then it should apply.
I don't
want
know
it for sure.
how much time we have, because I don't see that timer working in half an hour status, so I don't know. But I think I have like 2-3 minutes left, so I would open the floor to the audience to ask. I mean, we have here, Cecilia introduced herself. Carmen didn't have the time to do that properly, but because you know her. But we have here 2 amazing women, know everything about the subject. Please ask her, Cecilia, or ask her, Carmen, what you have in mind that you want to know about this or about the industry, please. Who starts? We have a shy audience.
No, I will add something on a note previously. There's a report by the World Health Organization that was published, I think, a couple of months ago. If we invested 20 cents per person per year, we would save millions of lives of patients.
Yeah.
So it's not that huge an effort.
But it is not just about funding only, it's the mechanisms, it's the instruments, it's to accelerate, it's to shorten the times. So
can I ask a question to you, since you're not asking a question to me?
Please do.
Do you believe in embracing the opportunity to make healthcare an industry of Europe where we can flourish and be a powerhouse? Hands up.
Who's going to go for that? Yeah. Not everybody, huh?
No, why?
Yeah, why? Those that wouldn't raise a hand, why?
Don't you think we have the competence to do it? Or what's lacking?
Yeah, we have the competence, we have the knowledge, but we don't have...
We have a question there?
We have a question
right there thank you.
Right there at the end. Just 1 second.
Yeah, I had a question here in the back. Thank you for the really great presentation. You already touched upon it a bit, that we have kind of this very dispersed scene of different hubs and different sort of centers of intelligence in different parts of Europe. That is really true. I'm representing one similar hub in the Nordics. And I wanted to ask you, how do you feel that when you talked about the community as well and how we should collaborate more, so what could we do to collaborate more in Europe? Because I think that's not something that we do awfully a lot, and we could definitely do it more to increase the kind of the competence that we have in this area.
I don't know, but
I think we do collaborate, actually. I think we are strong at collaborating.
I think the EU has a lot of good initiatives for collaboration, and it's now geared towards building best practices, so actually learning from each other and hopefully implementing EU-wide, which would be a great movement. I think that would be humbling to us all, that we would actually just do what Carmen suggested before. I think we come from a heritage where that didn't happen. I come from a country, Sweden, 21 regions, where the whole country is the size of Catalonia, which is why it's pathetic that we have 21 decisions made. But that's a different thing. So I really want us to embrace that fact that, build on best practices. Globally, we can do that, and in EU, we can do that. So I think we need to change the modus operandum there. And that's why when you look at the chart of the regulatory framework of Europe, it's maddening because, as you rightly said, Carmen, if you pass the MDR, you still have to get the approval in the little Saxon Germany region, right? Why do that? Why should patients elsewhere in the world have better treatments than in Europe? And again, back to the fact, we have been good at consolidating data. We are good at collaborating, not the best, but we can be the best. And we have an opportunity to have an industry that I don't think is identified by any other region right now.
Carmen?
Big player in, I think we could be a big player thanks to the data in being able, being able to actually, create a lot of predictive care.
Actually, I think that the bunch of data that we have from our public systems in Europe is not comparable to, it's much broader and stronger than when you can have in other regions in the world that it goes through other type of organizations. The problem that we have is also the policy that allows, GDPR allows for much more use of the data that it actually is allowed in the different countries. So what we probably need is an open mindset, getting it from other regions in the world on how to use, even sticking into the walls of the GDPR. So this is what EHDS is doing, trying to harmonize those countries that are going farther and those countries that are lagging there. But I think that we have, this is lucky. And I do think that we have a lot of collaboration in Europe, probably. This is good to hear that there's other visions, but I think that Europe did a great work with the FPs, from FP3 to the new FP10 that is going to arrive in some years, because the focus is the collaboration, at least 3 countries working together for every single project that is funded. This is a very strong asset for collaboration at the end. So I don't know, I think we are out of time, but we have a question there, yeah. Oh, a couple, okay.
I just had a comment or an answer to the question why, for example, I didn't raise my hand, because I see a certain risk for the patients, and if it's economically driven and an industry, I see a risk, an ethical risk for the patients, because not everyone is so passionate, trying to improve the patient's health. Some are really only economically driven, and I have been behind the scenes, and I have worked as a doctor, as a medical advisor for some startups, and it's not always very clean and very patient-centered.
But I think that's why you need
You need regulations, and it's true. I think we should need general regulations in the whole Europe, and not each and every country with his own regulations. I'm from Germany. I know how really strict they are.
You're fast in reimbursing, though. That's very good.
Yes, and I think, so I see...
No, I see your fear, and I think that exists in every industry, whether you take it clean tech or energy. Here it's lives, of course, but I would always probe for saving lives than not saving lives. And today I think we have a lot of technologies that have never been implemented in Europe that are saving lives elsewhere, and that sucks.
But let me just, because I think we are out of time, but let me just use the word industry as sector, not as a, bunch of people that try to monetize everything that happens in the healthcare. But I think it's a sector more than an industry, but I think it's...
I think, unfortunately, when fortunately or unfortunately, when you treat it as an industry, you make sure that there is a return on investment, and that is also a patient is a return. Yes. So saving a life is return on the investment.
Quality of life.
Yeah.
I think we have to stop here. So I would like to, applause Carmen and cheers with them. Yeah, thank you. Cheers with you. And ask you very quickly, how many of you will read now Draghi Report after this?
Do a chat GPT.
Some more. Okay, that's a good job we did. Thank you very much.
Thank you.